Hi, I'm Teresa Nelson, the health coach at the Connecting Care Clinic. Thank you for joining me today. I'm just going to go over heart attacks a little bit, the symptoms and risk factors, and some things that we can do to hopefully change that course. So, in the United States, about every 40 seconds or so, someone is having a heart attack. So, this is something very serious, and I hope that you can use this information. So when a heart attack is happening, is that the blood flow to the heart is either blocked, um, or and then also your heart is being starved of some oxygen. So there's some damage or some injury happening to the heart. During the heart attack, or parts of that muscle could also die. So we really want to take care of our heart. So remember, if you're thinking about the symptoms of a heart attack, the thing that we probably kind of relate to most is we see it on TV and people are holding their chest and that's they're showing us that they're having a heart attack, and that can happen. But some of the other symptoms that happen is that deep pain in the chest, and so that's where that usually comes from. But you can have some pressure in your left arm or pain, and you can have it in your jaw, in your neck, your back. So it can be that sharp pain or that really deep pressure. And then some other people have like nausea or vomiting. And then we think of the asymptomatic symptoms. So especially in women and people with diabetes, you'll see some of these things happen again. So people don't really realize that they're having a heart attack. So let me read over because it's quite a list. So a cold sweat. So women might notice that more than men when they're having a heart attack. Dizziness, lightheadedness, shortness of breath, that shoulder, neck, jaw, back pain, abdominal pain, heart flutters, and nausea and vomiting. The paleness or clamminess in your skin can happen, and the inability to sleep, and then also some unusual fatigue. So if you're feeling any of these, don't hesitate. Call 911. The sooner that the heart attack is stopped, or the better of your chances, and the less damage it's going to do to your heart. So we really want to take this serious. The major risk factors all relate to lifestyle. So smoking, the obesity, being overweight, it relates to our diet. So if we're not eating a very healthy diet, lack of exercise or physical activity. And then also some of the things that you might not always think about is, your blood pressure, your blood sugar, triglycerides, cholesterol. So when all of those are off, that also can trigger a heart attack. And then some other risk factors that you don't always have control over is your age, gender, and then family history. So if you have someone that is like first degree relative that has had a heart attack, that puts you at risk more so than someone who doesn't, for having a heart attack. So we really want to take charge because these are related to our lifestyle and how we are eating and taking care of ourselves. So, very first thing is eat better. Okay. Um, let's focus on our diet, and not just for a moment, a week, 2 weeks, a month, a year. Let's just think about how we can make our eating pattern better for a lifetime. And of course, including your family. So following the DASH diet or the Mediterranean diet, those are both diets that have been shown to lower your risk of heart attack. Get active, so that 150 minutes per week. Averages about 30 minutes, 5 days a week. So if you can get that in, and try to remember that it doesn't have to be a full 30 minutes at one time. You can break it up into three 10-minute chunks if that's what works better for you. Or or you can even break it up even more than that. But we really want to be getting our heart rate up, oxygen flowing throughout our body into our lungs and our heart and our brain. So that we can hopefully prevent a heart attack, stop smoking, lose weight, and then control our blood pressure, our cholesterol, our triglycerides, and then our blood sugar. So those all kind of come together as our diet. So, you know, up to 30% less likelihood of a heart attack if you are making very good diet habits. So if you have any questions, you want to talk about any of this or any other lifestyle change that you are ready to make, please reach out to me at the Connecting Care Clinic. Otherwise, you're more than welcome to email me, and that would be at Teresa, Teresa .Nelson, Nelson, at thetacare.org. So take care of your heart, and thank you so much for joining me today. Bye-bye.